Well, good evening. My name is Rob Hansen, and it's my pleasure to welcome you to this edition of On the Front Lines with the Emanuel Hospital Association. We're so glad that you've joined us wherever you are joining us from tonight or this morning, as the case may be. I say hello to you from the Emanuel Hospital Association offices in the USA, in the Chicago area, and my name is Rob Hansen, and I'm very, very glad to have the opportunity to welcome you and to ask you to invite others, even as you're watching, to join us. Just a couple of housekeeping matters. Our session today will last probably about 45 or 50 minutes, maybe an hour, and we're looking forward to covering a wide array of things about Herbertpur Christian Hospital, and we'll talk a little bit more about Herbertpur in just a moment. One housekeeping matter, you may notice that there is a chat stream that's available to you, and we have some of the members of our team monitoring the chat stream. And so if you have questions that you'd like to ask our guests tonight, please go ahead and present them in the chat stream, and we will select them, and we will share them with our guests and have an opportunity to look a little more closely at the particular things that are of concern to you. As I said, our focus tonight is on Herbertpur Christian Hospital, located in Uttarakhand, and so I'd like to ask us if we could bring in our guests, and I will introduce them to all of you. So we're going to be joined in just a moment when we switch over to the hospital by Dr. Mathew Samuel, as well as Dr. Viju John. Good evening and good morning, gentlemen. How are you guys today?
Oh, we're doing well. Good evening, Rob.
Good.
Good evening, Rob.
Nice to see you. So glad to have you with us. And I know that you're sitting in the chapel there at the hospital. Lovely room. And I know you guys will talk a little bit about the facilities and so forth. We're really very, very glad to have you. Dr. Mathew, maybe Dr. Mathew, maybe you could just wave your hand so everybody in the audience knows who's who. Okay, Dr. Mathew and Dr. Viju, okay? Dr. Mathew serves as the managing director at Herbertpur, and Dr. Viju is the chief medical officer. And so they're going to spend a little bit of time talking with us about their involvement at Herbertpur, how they got involved in missions. We're going to talk a little bit about some stories. You'll want to stay with us and hear some of the stories of impact that they have had as they have cared for various patients. They're going to talk about some of the needs that they have. They're going to talk a little bit about the whole area around Herbertpur and what it's like and what the Ministry of Emanuel Hospital Association is all about. Just briefly, by way of introduction, the Emanuel Hospital Association is a network of 19 hospitals, as those of you who saw the video prior to our going live heard and saw. We also have 60 community health and development projects, all scattered all across North and Northeast India. And we'll look a little bit more closely at a map in just a moment so that you can locate where Herbertpur in particular is located. EHA serves as a whole about 3 million people every year. Their services extend out through the community health and development projects. And then they also have about 800 to 900,000 patients that they see at the hospitals. And then those services are provided by a team of about 200 doctors, almost 1,000 nurses, and then 1,000 other professionals, support personnel, and so forth. So for those of you who are not so familiar with the Emanuel Hospital Association, it is the largest non-governmental mission hospital network in the world. And so we're very, very pleased to have the opportunity to share with you tonight about the work that is going on at just one of those locations. So with that as a bit of an introduction, I'll stop talking because people really want to hear from you too, not me. And so maybe if we could just begin by having you talk, Dr. Mathew, just a little bit about, tell us where Herbertpur is located, some of the particular characteristics that maybe make your area distinct from some of the other areas where EHA serves. Just begin to give us a bit of an overview.
Yeah. Rob, Herbertpur is situated in the state of Uttarakhand in the North India, earlier part of Uttar Pradesh. We say that it is situated in the Doon Valley in Dehradun area. Dehradun is a popular city known for hill stations and tourist areas. So we are 1 hour from Dehradun, and it is at the confluence of 3 states. We are in Uttarakhand, we border Uttar Pradesh and Himachal Pradesh. And we serve people surrounded by people living in the hills of 2 areas. One is the Jaunsar tribe and in Uttarakhand and in the Sirmaur area. So most of the patients we serve come from these hilly regions where medical care is quite nominal.
So some of you may be looking at a monitor similar to mine, and we flip around a little bit with regard to how the screen's oriented, but there's a little circle at the top of the green area on the map, kind of a reddish screened area. There we go. And that's the particular area where Herbertpur Christian Hospital is located. And the whole green band sort of represents, broadly speaking, the area in which you will find Emanuel Hospital Association operations and facilities. So good. Well, that's very helpful. Thank you. Thank you for that. Now, maybe we could talk just a little bit about the history of the hospital, but one of the things I'm going to ask Dr. Viju to share a little bit about this. One of the things that everyone is concerned about every single time we talk with anybody about Emanuel Hospital Association is how things have been for you and your team there at Herbertpur with regard to COVID, how you face that, what the situation has been with the staff, have staff had it, how are things going, and so forth. So maybe you could just share a little bit about that, and then maybe share a little bit of how the hospital got started.
Good morning, and it's indeed a privilege to be talking with you, Rob, and through your network to others. Yeah, COVID really hit us really bad, but the decision that we had to make was whether to keep it open. So we decided that we will continue, and that was a brave step for many of the staff. Many of the hospitals around, except for the government facilities, closed down because of the safety concerns. So we kept it open, first of all. And then we decided that we needed to be safe, both for the staff and for the patients. So what we did was we made arrangements in such a way that patients who had flu-like symptoms, like COVID symptoms, were separately managed and treated so that they would not enter into the main hospital area. At the same time, we started to prepare the PPE kits, personal protection kits. We made it in-house, our masks, our face shields, our clothing, we made it ourselves because it was difficult to get and it was quite expensive. So
just to be clear, you actually made your personal protective equipment, gowns, masks, face shields. I think I even saw a picture of one of your staff with the whole thing on, and those were all made there in location. Wow.
Yeah. Yeah, thanks to our staff and their innovative ideas. So of course, we sort of asked around so as to be very sure of the quality of it in terms of its safety, and it was pretty good, and we are still using it. So that was one thing, and we kept our services open, especially our emergency services. So the deliveries were happening. Emergency surgeries were happening. So these were a few of the steps that we made sure, and we stuck to the government guidelines of keeping safe distance, keeping hand sanitizers in different places, so as to make sure that that everything is in order. by God's grace, we didn't have COVID infection for the staff, except for, I would say, 2 or 3 in the later part, not in the initial part, the later part. So we were pretty okay, and we were happy that we could continue our services during this COVID times.
Yeah, well, that's good, because I know that some of the EHA hospitals, the experience has been varied, because some of the hospitals have not been able to continue to function in quite the same way. So I'm glad to hear that Herbertpur has been able to do that. So let's roll things back a little bit and go back quite a few years and have you, and I'm not sure exactly who's going to take this, but share a little bit about the history of Herbertpur Christian Hospital, because I think, if I'm correct, when the founder came, and I'll let you talk a little bit about who that was, but when the founder actually originally came to Herbertpur, I don't think there was anything there at all, was there, from a medical care standpoint, or very little at least? So maybe just give us a little bit of a rundown of the history of the hospital.
Yeah, absolutely. It was way back in 1936, and 1936, you could imagine that nothing much was there, especially in this part, which was a part of, as Dr. Mathew said, part of the big state of Uttar Pradesh. And it was quite a rural area. And 1936, Dr. Jeffrey Lehman and his wife, Monica Lehman, came here and started this hospital. It was first started, it was a tea garden which they bought, and the first clinic was started in the veranda of a house, and later it has now developed into this big hospital. Jeffrey Lehman started his career not as a doctor but as an engineer, and he was a civil engineer. And after his initial graduation, he went on to Oxford to do his PhD. And it was during his PhD time that he went to one convention called the Keswick Convention, and he heard one missionary from India talking about the needs in India. He was challenged, and at the end of the sermon, the missionary from India said, "And the medical needs of India are huge." And then here, this young person is all ready to complete his PhD in engineering, wanting to serve the Lord and even go to India. But then he heard that the medical needs are great. He decided to go and join a medical school and become a doctor. So that's how he became a doctor. He came back. They got married, and as a young couple, they came to this place, and they selected this place, and they started off. So they started off very slowly, and Dr. Lehman, being the civil engineer, he himself made the bricks, constructed the hospital brick by brick, literally, and then he established the hospital. Yes, that's how it all started. But in 1970s, there was a change in the political scenario in India, where many of the expatriates were asked to leave the country or become Indian citizens. So many of the hospitals which were started by expatriates, the founders had to go. So that is when this hospital, along with many other hospitals, came together and formed the Emanuel Hospital Association. And then this was one of the initial hospitals to be part of the Emanuel Hospital Association. So from around 1970s, it has become a part of Emanuel Hospital Association.
So as a hospital, you're within sight of the 100-year mark. It's a little ways off still, but that's really quite remarkable. And when I was last in India and visited you just before COVID, it was last February, a year ago, I had the privilege of sitting down and talking with Sue East, Dr. Lehman's daughter, and had a wonderful visit with her, and really appreciated the opportunity to share with her and hear sort of firsthand what her experience had been like. I should mention to you that we have one young man who is watching tonight, who's from South Carolina in the U.S., and he's indicated that he had critical lower back surgery with you, Dr. Mathew Samuel, and he is doing great, and he expresses his appreciation to you. So I just thought I would share that. You'll have a chance to see that in the chat stream a little bit later on. So, well, this is really great. And now one of the things that I think is one of the purposes of this is to give people around the world a little bit of a vision with regard to their profession. Obviously, you are doctors by profession. We have other professionals that work with EHA, financial people, HR people, and IT people, and so forth. But you have chosen to pursue this at this point in your career as a calling, really, with regard to ministry. And I always like to paint a vision for people, for young people, sometimes for older people who are thinking about retirement, post-retirement involvement. What could they do? What should they do? How should they use their gifts to serve other people? And so maybe you could share, each of you could just take a couple minutes and share how you sensed God's call on your life to go into medical missions that you have. So I don't know who wants to go first, but one of you just tell us a little bit about your experience.
Yeah, thank you, Rob. I think this question puts in focus, when I look back, it's been 25 years in missions. And it was as a very young, medical school graduate, I heard about missions. But before that, I grew up in a church where there was a lot of talk about, what Christ did. And one thing which I had always in my mind was how to put my faith in practice or in action. The other bit was I studied in a government school all through. My education was literally, I would say, free of cost. So I thought I have indebtedness to my nation. So these two things made me come to missions. I heard about medical missions through EMFI, which is Evangelical Medical Fellowship of India, working with medical students and graduates, giving them a vision of the opportunities we have in the nation of India. And through that, after I finished my orthopedic residency, went to a place called Christian Fellowship Hospital in Odinchhatram in South India. And I worked there for 1 year, and working there with a community who have dedicated their lives to people in the rural India, and also the scope of work. So as a young orthopedic surgeon, I wanted to use my skills. And I thought, if you go to a big hospital, you will become a specialist and you do only a small bit. Whereas in the missions, it allows you to practice all your skill. So today, 25 years on, I'm really happy and proud that I've chosen this. There were some, sacrifices, but the returns are much more. I do trauma. I can do deformity correction. I can do, spine surgeries. I'm glad Leifin is watching, and also involve, be able to do joint replacements. And this kind of wide array of services to offer to somebody who probably would not be able to afford it, and that too in a nation of India, is a great privilege. Later on, I'll be sharing some stories about how it all motivates. And finally, it boils down to what you gain in life. I think we can help people who otherwise would not be. And that's a great challenge. And if there are young people watching, I would say that this is a great adventure and you will never regret it. And to those who later in life, definitely you can, come visit, do short-term missions, come and work, come and see, probably share your experiences with a wider range.
Before you went away. So, all right, Dr. Viju, tell us your story.
Yeah. So it was in medical school that there was one prayer group that I used to attend. It was called the Christian Medical Fellowship down south in India, in a state called Kerala. And we used to have visitors from different hospitals, especially from Oddanchatharam Hospital, again a mission hospital, coming and telling about the needs of our country and how they serve. So this challenged me to consider missions as my career. And then after my post-graduation, I joined a mission hospital in Orissa and later on moved to Herbertpur. So when I was in the medical school, I came to know the Lord and I committed my life to the Lord. And this made me aware of the needs around. And when I saw the needs in our country, I thought I should be able to. I should give my services to the care of needy and those who cannot afford. So that's how in very short how I ended up here, and it has been a privilege. I have done pediatric surgery. So when I had to decide on which specialty to take for my post-graduation, I took surgery because there was a saying that a surgeon can treat a medical case, but a physician, an internal medicine specialist cannot do the otherwise. So that sort of helped me, and this surgical specialty has helped me to be involved in various areas, be it obstetrics or gynecology, be it of course pediatric surgery, and also of course to see patients who come with other medical ailments. So God has been good, and God has been faithful. And as Mathew said, it was an adventure. And as we'll be hearing, stories of patients really motivate us and take us forward. So thank you for asking this question.
Well, I think it's always moving to hear the story of how maybe God takes us from where we are and just through a series of steps, sometimes big steps, but very often little steps and little conversations along the way, and leads us to where he wants us to be. And so it's always inspiring and encouraging to hear the stories that those of you who are serving with EHA, and indeed people who are serving in whatever arena in life that God might have called them to. So thank you for sharing your story. So let's get into the specifics of Herbertpur just for a few minutes, and we have quite a number of people sharing very, very nice comments. So thank you very much. We appreciate all of you that are commenting. We are paying attention to your comments, and we will look forward to reading them in great detail once we're off the air. But maybe you could share just a little bit about what Herbertpur is like. I know that EHA has intentionally focused on efforts that will serve the poor and marginalized. Depending upon one's experience, one's perception of India is quite varied. We think of India as a great nation on earth these days. We think of India as providing incredible expertise with regard to a wide variety of industries, not least the IT and tech area. But the reality is that there are significant numbers of people who are still poor, who are still marginalized, and who are in need of the kind of care that Emanuel Hospital Association is called to bring. So maybe you could talk a little bit about the patients you see, the services you offer. Having visited Herbertpur, I mean, it's a big operation. I mean, you have a lot going on every single day. I mean, how many patients would you typically see through the course of a day? Typically, what would the numbers be?
Rob, on a given day, in the outpatient, we see about 350 to 400 patients. So in a year, it's over 100,000 patients who come. We have 120 beds in the inpatient. And as Dr. Viju said, our services range from, obstetrics, normal deliveries, complicated deliveries, to complicated surgeries. We do, pediatric surgeries, which probably in Dehradun, there are only 3 centers in Dehradun where pediatric surgery happen. And we do joint replacements. We do, neonatal ventilation. I guess it's a privilege. We have a big team now of 24 doctors
Really?
in 10 specialties, which is a great achievement for a hospital in rural India. We see, more than 1,500 deliveries happen. We have 310 staff. About the families who come in, I guess the families are varied. We have people who travel 60 to 80, sometimes 100 kilometers. They travel 6 to 8 hours, sometimes walk a couple of hours, then get public transport and reach here. I would like to just share one story of a boy called Milan, who came all the way from Assam. Assam is the northeastern state, and we have a hospital in Makunda.
I have to interrupt you for a second. And because you said that this young man came from Assam. So those of us, I can tell you that the many who are watching here in the US are geographically challenged, and they don't really know the size of India. So I'm just going to take this. I meant to do this earlier, but if you took India and you put it down on the United States, which is a country the size of which I know, and many of those watching know, not all certainly, but if you put India on top of the United States, the northern part of India would reach into Canada, and the southern part of India would reach into Mexico. The western portion of India would reach to Salt Lake City, Utah, and the eastern portion of India would reach to Washington, D.C. Now, you said that he came from Assam, and so if you look at that map that is on the screen now, way up in the very, very upper right in the green area is where Assam is located, and you are over at Herbertpur. So he came all the way from Assam. That's a long ways to come. So now go ahead, tell the story about.
This man traveled 2,000 kilometers. He was brought by his old father, and they had a small piece of land. So this boy is the only graduate in the family. All others are manual laborers. This boy had dreams of, getting a government job, and now he suffered from ankylosing spondylitis, which is a crippling disease. His back is stiff. Both his hips were fused. He could not sit on the floor. He was, going to his toilet standing. And it is in that state he came to Makunda, and Dr. Janand and Dr. Ann, who were there, they called me and asked, Mathew, can you do a hip replacement? This was a complicated hip replacement. I said, we will try. And this man traveled for 2,000 kilometers, sitting in the train for probably about 3 days and reaching us. His father, had a rucksack or a sack actually on his head, and that was the belongings, and this man on a stick. And when he came, but I was helpless. This is a huge surgery, which probably was difficult for me to do it alone. And I will tell you, my friend came from Kerala, which is 3,000 kilometers down south. Wow. He flew down. His name is Alex, my very good friend. And he flew down, and we operated on him together, the first hip, and he was doing well. Then he said, doctor, you have to operate both the hips and you have to make me walk. I came on a stick. I want to go back walking on my own. And he stayed with us for 4 months. And both his hips were replaced. For 4 months of treatment and stay and, everything, he became part of our community in one sense. But the bill was huge. Even in our Indian terms, his bill, I think, came to more than 400,000 rupees. And he paid probably less than 100,000. And 75% of his cost could be written off because we wrote to families, friends, even our staff contributed. And this man could not believe. So when I first told him about, the surgery, he thought he had a nightmare. You know what? because he thought, who will do my surgery literally free of cost? And he went into a tantrum saying, somebody has taken off my kidney. He thought, we have operated on him and taken one of his kidneys to be sold in the market. And it took actually counseling and, some evidence for him to see that there are no scars on his back or on his abdomen. And to cut the story short, it's been 5 years. Today, this is a picture when he came back to visit after a year. And I could not believe my eyes. And I want to thank friends, families, and it was a huge achievement. And for me as a surgeon, I think, I would have done it free of cost if I could, treat such a patient. Even in a big institution, this was a challenge. Both anesthesia, surgery, post-op, he didn't have anybody. We sent our own hospital van to get a blood bank. We don't have a blood bank because of a lot of regulations. So this surgery could be done. I thought this case is something which is very precious to me, that I would not be able to do it even if I was, in a big hospital. And I think Dr. Viju would be able to add some more stories of challenging cases which keep us on.
Good. All right. Thank you for sharing that. Dr. Viju, go ahead, share some of your stories.
Yeah. There are many challenging cases and stories, but the most recent one was a 2-day-old child who was born here with a congenital abnormality of his foot pipe, which was connected to the windpipe. This is called Tracheoisophageal Fistula. So this is a challenging case, and to be done on a 2-kilogram baby is quite a difficult task. So we had a team together, our anesthetist, Dr. Anu and Dr. Davis, along with our theater staff. And to back it up, we have got a new pediatrician, Dr. Vinod, who was just trained from a Christian institution, Christian Medical College, Vellore. So we decided that we would take up this challenge, and they come from a place which is in a hilly area. And as Mathew said, this case would not be done in any other hospitals in whole of Uttarakhand, actually in 1 or 2 big institutions they have, and of course, financial problem they had. And to convince them that, this should be done and this could be done, and money is not an issue. So we had to do 1 day of convincing them. And it was a Sunday morning that they finally decided to go ahead. And the whole surgery took around 5 to 6 hours. And by God's grace, everything went on fine. The child was on a ventilator for next 4 days, this small child, and the new neonatal ventilation and Dr. Vinod to manage that was actually a great relief for all of us. And this is the picture when they were ready to go, and the child was feeding on its own. The foot pipe and the windpipe was disconnected, and it was operated. So this smile on the face, of course, is something that keeps us going. So this is the picture when the child was on the ventilator, the picture that had come. So this surgery we have not done. I don't think our hospital has done in the past 86 years. I might be corrected, but then so this was one of a milestone which we could achieve by operating on a small child, which we do, but then to be connected to a ventilator and to keep for 4 to 5 days. I think this shows in the coming days we are in for greater challenges.
I know you've got another story you want to tell, but I think one of the points that I would want to underscore, something that you alluded to, one of the reasons that those who are poor and marginalized, one of the reasons they're hesitant about coming to get medical care is because they're concerned about whether they're going to be able to pay or not. Isn't that right?
Yes. When we say that we really told him money is not an issue, but then they just cannot understand that sentence, because money is always an issue everywhere. So when we say that, you be willing for surgery, we will manage whatever you can give, you give, the rest of it we'll try to take care. So that is something that for them to understand and to comprehend is very difficult. And so that is a big challenge. Many of especially the pediatric surgery cases, they don't go ahead with the surgery because of the huge cost that is involved, because these surgeries can be only done by a team and with quite a bit of sophisticated equipments, which increases the cost, and many of them then opt out and say that we just cannot do it. So, but then the inevitable result is the child cannot survive.
That's very interesting. Now you've got another story you want to tell, so I'll give you the opportunity in just a minute. But one of the things that also strikes me about the care that the poor oftentimes need. So many of the poor, all of the poor, I guess, who are working, who are able to work, are day laborers, and so the whole idea of taking some days off in order to get a surgery performed, it's not only the cost of the surgery, it's also the cost of the family and the whole household of lost days of wages. And so there's sort of like a double whammy, as it were, if you were to say it that way. And the whole idea of the safety net, in a very real sense, those of you who are at hospitals such as Herbertpur are a part of, and a significant part of, as it were, the medical safety net for those who are poor in India. Isn't that right?
Yes, I cannot emphasize it more. You told it very correctly. Many of them are not able to come forward because it's not just the expense of the hospital. They are daily wage laborers. So how many days they stay here, they don't get any income. So that adds to their debt or their financial problems. Very true.
Right.
Yes.
Yeah. Okay. So, you're going to tell another story, I know. So go ahead and share that.
So many a times we are not able to completely sort of cure patients. We are limited because of many things, but then we do our best. Then a good example of this was this 4-year-old boy, Shaurya. Shaurya, the word meaning is courage. He was playing outside his house, and it happened to be a road, and one speeding vehicle hit him and sped away, and he was brought to a casualty with head injury. And we don't have a neurosurgeon, nor we have imaging technique, imaging equipments here. CT scan we didn't have, so we had to refer him. So that was it. We stabilized the child and we sent him off. And after 2 days, I get a phone call by someone who knew this family and who knew us, telling that this child is not doing well. They have taken to a hospital where they have intubated him, or connected him to a ventilator, and he's not doing well. Can we bring him there? But then I said, we are limited. We don't have a neurosurgeon. He said, I'm not keeping the child here. Our bills are just going up. The child is not recovering. I am bringing. And then, lo and behold, after 2 hours, this child on a intubated with artificial ventilation was brought here. The CT scan revealed that we couldn't do much of a surgery. It was mostly non-surgical intervention. So that gave us a little hope. And we took him inside, connected to a ventilator. And he was unconscious for about more than a week. And then we did all the supportive care that is necessary. All the staff really took this as a challenge and took care of him. And slowly the child started recovering. And after 6 to 7 days, the child opened his eyes and got up. And then we had to do a tracheostomy because the child was with the endotracheal tube for a long time. And slowly he was completely paralyzed. He couldn't move his limbs. Slowly he started walking. That's a small video that we took when he took his first steps after probably 2 to 3 weeks. He was unconscious and lying down. And
so now we're going to see a little bit of video. Just
yeah, so yeah, this site is worth more than thousands of rupees. This keeps us going. So he's still not out of woods. He has a tracheostomy tube. Still, we are not able to remove it. He needs little more treatment further on. But again, his bill after staying here for 2 to 3 weeks came to a huge amount. Their father was a daily laborer who worked in a medical shop outside. They couldn't afford it, but we could give charity because of the help of our friends around. Yeah, this is the story of Shaurya.
That's remarkable. That's a wonderful story. Well, so there's so much that we could talk about, and so this is just wonderful. A few more things that I'd like to cover if we could. So let's talk for just a minute. EHA has, across all of its units, has 6 nursing schools, and so maybe one of you could take just a few minutes and address why nursing schools, why a nursing school at Herbertpur is needed, is helpful, and what the sort of the vision for nursing is. And those of you who are nurses in the audience, I want you to know that coming up one of these months, it'll probably be during one of the summer months. I'll share what our future schedule is near the end of the broadcast tonight. But coming up in the summer months, we are going to focus on nursing overall across the Emanuel Hospital Association, because it's an absolutely critical component of what you do. But maybe share a little bit about what the School of Nursing is like there at Herbertpur and so forth.
Yeah, Rob, thank you for this question. I think nurses form the backbone of any hospital. The doctors, get the credit, but it's the hard work, the difficult work is done by our nurses. And all over India, there is a huge shortage of nurses. There are a lot of opportunities abroad. Indian nurses are going abroad to the Western countries and to Gulf countries where they are paid handsomely. Also, there are a lot of opportunities in the government. That means for the missions, very few stay on. And having good nursing care is sometimes a limiting factor to doing critical work. And with that vision, EHA has been training nurses. It serves 2 purposes. One is you give opportunity for rural youth who would not have training to work. Second, we can train better quality nurses who would also help out, because many of them have a service commitment of 2 to 3 years, because we offer subsidized nursing. I would like to tell our viewers that for as little as $1,500 a year, you can train 1 nurse. That's very minimal. And you have to, support from 3 years and you have a nurse ready. For under $5,000, you train a nurse. And it is a great service, not just to missions, but for the nation of India and to the world. And at Herbertpur, we began our school in 2013, initially with 20 nurses. Now we take 30 students every year. So 30 nurses are graduating each year. The 5th batch graduated this year.
That's wonderful. That's wonderful. Yeah, that's great. Well, so there you are, folks. You've heard it. This is one way that you can, if you're wondering how you can get involved with the Emanuel Hospital Association, you can certainly get involved and support the education of nurses. That would be a wonderful sort of thing for you to do. One of the questions I think that is going to be in people's minds is, you talk about giving charity and not charging patients. How are those bills paid?
Yeah, just to add to that, as I said, a nurse to train for a year is $1,500. But even the $1,500 is too much of a money. And for many of the students, we write off $600. So for as little as probably $1,000, we are able to train a nurse for a year.
Okay.
Similarly, what happens is our patients, many of them pay. So from whatever little they pay, we save. How we are able to save is most of our staff, the doctors, the nurses, probably are working less than 1/3. They will be paid in the government, and probably a minuscule if they get if they had gone outside. So our overheads are not as much, but with the present scenario, there are a lot of standards to meet and a lot of equipment to get. So the cost is slightly rising. So we are able to also write off, because some people, we have a small corpus which we save to write off these bills. The other part is we are part of the government network. We do cashless service, and the government reimburses, though it is less, as part of the Ayushman scheme. So we partner with the government. So those are the two avenues. I guess our own staff, they are sacrificing. We have friends who give some money towards per patient, and the third, partnering with the government.
Well, that's very helpful, and that is one of the areas that we try to help as well with here in the U.S. is to raise resources, and that's one of the things one of the visions that we would like to cast for those of you who may be watching. You're hearing about needs, and so you certainly can pick the area that you'd like to become involved with. So we're getting towards the end of our time together. We're gonna end by 8:30 Central Time, because I know you gentlemen have to get on with your day. You've got a full day of work ahead of you at the hospital. But maybe you could talk a little bit about some of the needs that you have. I've been to Herbertpur a couple of times over the last number of years, and you have a very lovely new facility that is still being brought up to speed with regard to equipment and so forth. But it's a lovely facility that's been built through a variety of funding structures, but you still have significant needs. Maybe you could share a little bit about what some of the needs are that you have on the campus, and how people could get involved with that. And I mean, I think that you have needs that can be met for low prices, but then you also, of course, have significant capital investment needs in structures in order to be able to further the work at Herbertpur. So maybe share just for a few minutes about some of those needs.
Thank you, Rob, for asking. So it is the continuation of the answer to the question that how can we give charity. So what happens at the end of the day is that we don't have a large amount to save for capital expenses and our infrastructure. So that's where friends like Rob helps us through some of the listeners and the networks that we have. So in this respect, the two of the important things in the hospital that we are looking at is, one is the Rehabilitation Center. This is an hilly area. A lot of people come with fall and fall and spinal injuries, and there is no proper rehabilitation center here. We are fortunate to have a rehabilitation specialist trained from a Christian institution, Christian Medical College, Vellore, and we have a program for disability in community health. So we have a prior knowledge of it. So it is a good ground for us to start the rehab center. But a rehab center to starting with the infrastructure and of course the added personnel, that is a future challenge and a future need that we are looking into. Roughly it comes to around $50,000. So that is our dream that we have. The other one is a blood bank. We don't have blood bank because of various reasons. Though we have this many surgeries happening, for them to get blood, they will have to travel around 1 hour to get the blood and to come back. We lose around three to 4 hours.
Go ahead.
Yeah. So we lose around 3 to 4 hours. So we are looking for a blood bank, and there is an infrastructure need for that, and personnel has to be paid. So these would be the two important things that we are looking at when we look at the hospital side. And of course, we have some equipment needs like an ultrasound, which is pretty old that we are using. So that would be some of the needs in the hospital. But as Mathew said, we do not offer in salary equivalent to what the others give. But we want to take care of our staff, and one of the important needs for them is to have a proper accommodation. And but then now, since we don't have enough of savings to build accommodation for our staff, many of the staff still live in buildings which have been built quite some time back, by even during the time of Dr. Lehman. And so as the staff were young, it would have been okay. Now staff have grown up, they have big kids, so they have not much of privacy, and so that's one of our greater needs. Our staff are very accommodative. They still do not have much complaints in that sense. But then, as an management, we want to see that they have a comfortable stay. So that is one of the areas that we really are looking forward in the coming years, that we could give a good accommodation for our staff. So these are a few areas that immediately comes to my mind.
Yeah, that's very helpful. I think one of the things that people need to know is, correct me if I'm wrong, but it's important to have housing for a variety of reasons on the campus for staff. It's possible to live off the campus in the community, but it's not easy to do that, from what I understand. There are some issues with regard to quality of housing in the community. There are some issues with regard to I think, safety. And so these are some of the kinds of reasons, because one of the things that we would ask here in the US, we would say, well, why does the hospital have to take care of where the staff live? Why is that?
Yeah, two things, all of us work not just 8 hours, but 24/7. So we make do with a small number of staff. Some of them are very critical staff. So if they stay outside, they need to run, you have a complicated delivery, and you need a senior nurse at that time. She may not be on duty, we call her. So for professional staff, all doctors and all nurses, we try to accommodate them in the campus. That's one reason. Second is the safety. Many of our locations, if they stay outside, for them to come at night, is not very easy. Transport is not very good. The third is community living. The shared living, I think, is what keeps us together, that keeps us going. And we can share with small resources, we can give. Like in Herbertpur, we are fortunate, though our accommodation is very poor, the staff still prefer to stay inside the campus because, the water is good, electricity is provided. We have a school bus where kids can go. So I guess that's what keeps us going. And as a community, we grow together. I think that will answer the question. But the needs, definitely, this is one way to offset costs. If they stay outside, we will have to pay them much more. They will get probably poorer. So in all sense, having accommodation is critical for a service we offer.
No, that's very helpful. So you've shared a little bit about some of the physical needs. One of the things that I think would be possible is for doctors. Are doctors able to come and visit and participate work alongside you in any capacity, or what does that look like?
Yeah, that's an interesting question. We would definitely be helped if people come. We get expertise from anywhere. So that is one area that is sort of very helpful when people come with some expertise, be it doctors, be it in any area, and they come and help us out for a small short time. What happens for doctors is that we try to be updated as much as possible, but because of the busy work schedule, and we cannot be spared to go out for conferences and other continuing medical education. What happens is that we tend to be a little back on the recent developments. So if people can who are updated can come along with us and then be with us for some time, that would help us to update and to give us little bit of more of expertise. That is not just for doctors. It can be in IT, it can be in nursing. We have people visiting in various areas to help us out, and their visit definitely sort of encourages us one and helps us to catch up with what's happening around the world.
Yeah, good. That's wonderful. Dr. Mathew, were you going to add something?
No, I think
okay.
that, yeah, we are happy to have people come visit and come and contribute their skills to improve our work.
Good. Well, this has been wonderful. This has been a wonderful hour that we've spent together. I hope those of you who are watching have been encouraged by this. I can tell you that behind these men stand a whole host, a small army, small division at least of other doctors and nurses and allied health professionals, other professionals. And then the other thing that we haven't even touched on is an entire area of community health outreach that is an extensive portion of the work at Herbertpur. And that segues me into beginning my closing comments. First of all, I'll just say that if you're interested in helping support the work at Herbertpur, you can visit the EHA USA website and you can get all the information that you need about doing that. If you have any questions that you'd like to ask, please feel free to call us. I'd be happy to chat with you, talk with you, connect you with regard to specifics. You see there on the screen, we're supplying both the website of EHA in India, the EHA-health.org, and then EHA USA. So would encourage you to get involved if that is something that you have been prompted to do tonight. In the coming months, we plan to do these on the front lines events about once a month, and so we have the next several months planned. So for those of you who are watching, just to give you a little bit of a peek at what's happening, next month in March we will be focusing on the work at Chinchapata, which is a much smaller hospital, but a very vital work, one that in recent years has been had a resurgence and is having a significant outreach into the community surrounding it. So that's in March. Coming up in April, we will be back to Herbertpur and we will be focusing on the disability work that is a part of the Community Health Project. There's an extensive, vast work that's being done. They make prosthetic pieces in a workshop. They care for people who are disabled in various ways. A tremendous outreach work into the community, and we want to have an opportunity to share all of that with you, and that's in April. Coming up in May, we will be over at a hospital called Landauer Hospital, which is in the foothills of the Himalayas. Some beautiful views from Landauer, but also some very significant ministry and outreach that takes place from that hospital. So I'd like to thank our guests. Gentlemen, thank you very much for being with us from Herbertpur. We trust that you'll have a good day, and we thank all those of you who have been watching with us tonight. Thank you for joining us, EHA on the front lines, and we look forward to seeing you again next month. So invite a friend and enjoy us. Thank you.
Thank you, Rob, for having us over. Thank you. Enjoyed it.